All right, here we are at part two in boring little office. Okay, but I just want to I want to show you that horse skull. Let me just do that. Let me do that first. Oh, whoop, what did I do? Ah. Okay, let me just show you. So I worked with a really awesome gentleman named Larry Pocan, and he said, God must have invented the horse's head on like a Monday. Because his point is just that you can see there's a horse. I'm having my lunch, but you can just see that the upper teeth, they don't, as the horse is grinding his food, the buccal aspect of those teeth kind of hang over the edge. And the same, it's a little hard to appreciate, but the same thing happens on the inside, those lower teeth, the lingual aspect, they don't get a lot of action. So even though the horse is grinding his food, these teeth are going to keep growing. They're all growing, but they're not going to grind themselves down the way, the way the rest of the tooth would. So that's why that guy had to, that's why the veterinarian had to float that horse's teeth. And you will get a chance to do that. You're not going to do it a lot, but you will, I want you to get a feel for it. And then, well, anyway, this is a nice little model of a dog's. Just, you can kind of appreciate, we talked about the carnassial tooth. That's this tooth right here. And you can just kind of appreciate how gigantic that tooth is. And that's also the carnassial tooth in the lower, but just see how big it is. And if this root, oh, my fingernails are, I'm embarrassed. I'm embarrassed by my dirty fingernails. So, here, hide my fingernails. Anyway, you can just see how big that root is and how it would go underneath, the eye socket. And so they get these dogs with this nasty tooth root abscess. Okay. To continue, right? Okay. I just think this is a funny little. Okay, anyway, moving on. Now let's go on to the small intestine and other structures down there. We're going to learn about the pancreas and the gallbladder and, well, yeah, and about bile and the liver and all these really exciting things. So remember we said earlier how your small intestine has all these little fingers. Oh, by the way, the book it goes a lot on about CCK and these, I just don't care. I got to be honest with you. It's kind of interesting, but I'm not going to ask any questions about cholecystokinin or whatever. It's just, there's no medicines based on it. There's no diseases that it can, there's no such thing as well, if there is a deficiency of CCK, I've never heard of it. So there's a few things in the chapter that we're not going to talk about. Okay, so read it, please read it. But there's no test questions about it. Okay, so the intestines, like we said, they have these columnar epithelium, and if we get really close, we would actually see that it's not a flat surface. It has all these little fingers, and each finger has, right? Each little finger has all these other little fingers on it, and again, it's going to increase the surface area of your intestine, so it can do a lot more absorption. It's kind of like those really awesome fluffy bath towels or really awesome bathrobes, right? They just soak up all the water on you, and that's because they have a lot more surface area. And who is this moron drinking coffee in his bathrobe? Anyway, but you've been to some hotels where they have maybe really cheap towels, or where they have, like, you're all wet and they just will not dry you off, right? That's because they are not like your small intestine. But these towels are just like your small intestine. Lots of little folds and ridges and little absorbent fingers, okay? And guess what? That's exactly what makes dogs with parvo and cats with panleukopenia so sick. What do you think that virus attacks? It attacks um, those fingers. Um, Parvo is a virus that we see in dogs and cats, especially if they're not vaccinated. The vaccine is really awesome. It causes a severe enteritis with vomiting and diarrhea. These patients get dehydrated, and the virus just strips all these cells off of their small intestine. So again, this is one of those fingers, and if you think about it, your intestines, that's a fairly traumatic area, right? You get all this food traveling through. So these little fingers probably get, injured. These little cells, these little columnar epithelial cells here probably get injured, but that's okay because there's these things called crypts. This crypt is constantly making new epithelial cells. That's a nice thing about epithelial cells is they regenerate quickly. So you're always making these new crypt cells, and they are going to travel up, and they replace any other cells that get damaged. Okay, well, parvovirus attacks. It attacks these crypt cells. It attacks everything, I think, but you can't. It strips away all of your epithelial cells. So these poor little dogs and cats. Cats, it's called panleukopenia. They can't hold anything down. They feel sick. Now bacteria can get across. There's just no protection. So it's really is a horrible disease. Now the good news is if they survive it, which they often can with great nursing care, if they survive it, then the crypt cells will recover and they'll go back. They'll be like this again. But for that week, it's horrible. It's like a wildfire in their intestines, right? This is what parvo does, just mows down everything, right? There is no surface area there. Okay. The pancreas. What does the pancreas do, and why does it not digest itself? So the pancreas, has two different jobs. There's an endocrine job, that's to make things like insulin and glucagon, but it also has an exocrine job. Exocrine meaning it's going to pass some sort of a substance through a little duct. Sweat glands are exocrine, salivary glands are exocrine, and this part of the pancreas is producing various enzymes as well as bicarbonate to help you to digest food. Some of the digestive enzymes are that you may have heard of are lipase, trypsin, and amylase. Those are the big three digestive enzymes. The pancreas also makes sodium bicarbonate, and that's to help neutralize, all the stomach acid that's coming from the stomach. The sodium bicarbonate will help to neutralize that, so we don't end up with a bunch of acid, a bunch of acid in the small intestine. These three enzymes each do familiar things, okay? So you can probably guess what lipase does. Lipo, liposuction, lipoma. It's fat. Lipase helps to digest fat. Amylase helps to digest carbohydrates. So bread, potatoes, pasta, grains. Helps to break it down into smaller molecules, eventually into glucose. And then trypsin is protein. It's going to help you break down protein. The book goes into a lot of detail about all these other, chymotrypsin, all these other, just remember trypsin. Just remember the one, trypsin, okay? Yeah, there's the pancreas releasing them into the lumen of the duodenum there, right? Now, lipase by itself, so there's fat, right? Lipase normally is going to digest fat, but actually, fat, you know that fat, oil, and water doesn't mix. So fats tend to stay in these giant balls, and the poor little lipase enzyme just can't really break it down into smaller fatty acids. So we're going to introduce what bile does as well. We're going to just kind of slip that in here. Bile is made by the liver, and it's stored in the gallbladder, and it's like a detergent. It helps to break big blobs of fat into little smaller blobs of fat. Just like if you've ever tried to clean a greasy dish, detergent or soaps, they'll break the fat up. Well, that's what bile salts do. And you can call it bile salts or bile acid. It's all the same thing. And so again, this shows you, here's lipase. They're all looking very sad, right? Because they can't, there's just this one big ball of fat. But bile can break it up. You can see the bile on the little balls of fat. And now all of the lipases can start to work to break the fat up into fatty acids, and you can digest it. And the pancreas can have problems of its own. We're not going to say much, but pancreatitis is basically where those enzymes have remember how we said pepsin is stored in a form called pepsinogen? Well, all of those enzymes are stored in an inactive form. So trypsin is stored as trypsinogen. Well, if it gets activated while it's still in the pancreas will start to digest itself. And it can be very painful. It can be very dangerous. And we'll learn a little more next week and next year about a totally different pancreatic disease where it's not inflammation, it's just the pancreas is just not very well developed. And we call it exocrine pancreatic insufficiency, or EPI. And it's just the pancreas can't produce those enzymes. And so dogs with this disease, they just can't digest anything. The food, it gets digested through the stomach. It comes out as poop, but it looks kind of weird. It'll have this kind of greasy gray, or the greasy gray, kind of yellow color, because all that fat, for example, there was no lipase to digest it, for example. I just threw these in here just as a review. When there's like fresh blood in poop, what do we call that? We call that hematochezia. And when it's all digested blood, it's all black and sticky, right? We call that melena. But anyway, we can treat these guys with powdered pancreas, or it's an extract of pancreas. So I don't know, they must get it maybe from cows or pigs, but it's like you just feed them this freeze-dried pancreas, and that has all the enzymes, and they will go from looking like this sad little guy to this handsome dog. And I know I just told you about bile. Well, let's talk a little more about bile and the liver in particular. So the liver does so many amazing things. I guess every part of your body does, but the liver is pretty amazing. So we've said before, the liver makes stuff, it processes stuff, and it stores stuff, right? Makes, processes, stores. So it makes stuff like bile salts, plasma proteins like albumin and globulins. It makes cholesterol. It makes blood clotting factors. It'll store glucose in the form of glycogen. And it also processes stuff. I said stores stuff and makes stuff. What did I say? What's the third thing I said? Stores, makes. Well, it processes stuff. So it turns ammonia into urea, and it detoxifies other toxins via metabolism. So thank you, liver. Anyway, and a concept that is mentioned either in this version of the book or either the version you read, but a concept that it'll help you understand other liver diseases is this idea of enterohepatic circulation. So to understand that, I've made this a little bit wordy because the book just doesn't explain it very well. And by the way, the version, the chapter in your current edition of the book is just horrible. It's so horrible. It's unreadable. So that's why we're using this earlier edition, which is much more clear, but it's actually missing a few things. So I'm not even sure if I just read both chapters, so I'm not even sure if this is in that chapter, but we will explain it now. So enterohepatic circulation. So entero means intestines, like enteric or enteritis, and hepatic refers to the liver. So before we understand that, let's start by just reviewing what a regular capillary bed is. The liver has a very unusual capillary bed, and we're going to talk about the just a regular capillary bed. And this is, by the way, showing you what goes on with enterohepatic circulation, right? Bile goes into the small intestine, in the duodenum, and then in the ileum, it gets reabsorbed. It gets absorbed and gets recycled, basically. So that's what we're talking about, is how this happens. So a regular capillary bed is like this, right? You get oxygenated blood coming through an arterial, and then it goes through this low pressure capillary bed. And capillaries are these single-celled vessels. They're very leaky, so oxygen and glucose can go from inside to out. Carbon dioxide and waste products will go from outside to in, back into the blood. And then all of this will go into a vein and go back to the heart, right? Normal capillary bed. But wait a minute, waste products. We don't want waste products going to the heart. We want the liver to do something about them, right? We want the liver to detoxify these waste products. And what about if this capillary bed was in the digestive tract? Okay, we don't want all that good stuff, the amino acids. We don't want that just going to the heart. We want the liver to get a hold of that so it can build things, right? It builds clotting factors and albumin. So if all that blood is in a vein, right? If some of that blood may have nutrients, or maybe some of these veins have waste products, how do we get it to the liver? Well, that's where this weird capillary bed comes in. So the answer is that not all venous blood goes directly to the heart. Some will actually travel through this second capillary bed in the liver. So, for example, here's blood, and I guess I misspoke. So there is blood that has waste products. I guess it will go to the heart, but then some of it may travel through the hepatic artery and form this capillary bed, where it intermingles with this vein from the digestive tract that is also forming a capillary bed. And these two capillary beds come together. But we're going to focus on this kind of odd, a vein that forms its own capillary bed. So this second capillary bed allows all the good stuff that's coming from the intestines, amino acids, vitamins, and glucose. Even though it's venous blood, it's all deoxygenated blood. It travels through the liver, and all of that good stuff can be will diffuse into the liver, or maybe actively pumped into the liver, and the liver can build things and store things with it. Any bad stuff that's coming from the intestines, so poisons or waste products, they also, their first stop is the liver. And so the liver can, so I wrote ammonia, but of course that could be coming from anywhere. But let's say you ate some sort of garbage. Luckily, it's before it ever gets to the heart, it'll travel through the liver, and all of the zillions of enzymes in the liver should detoxify it. Okay, so what does that have to do with this recycling? Well, intrahepatic circulation involves some different things, but we're going to focus on bile. So the liver makes bile, and bile is actually very valuable. It takes a lot of work to make bile, so why waste it? If you didn't have this intrahepatic circulation, you would use up bile, it would help to break up fats for digestion, and then you would just poop it out, right? That would be very sad if you did that. Intrahepatic circulation allows this to happen. So the bile will do its job, and then when it reaches the ileum, it'll get picked up, enter the hepatic portal vein, and go through that capillary bed where the liver can then pull it out. And then that way the liver doesn't have to make bile from scratch again. It can use it to digest fat in the future. And we've learned before about a really sensitive test for liver disease called the bile acids test. And when we do this test, we do it in patients maybe we suspect have some sort of liver issue. It could be a shunt, it could be hepatitis, it could be a lot of different liver diseases. And what we do is we get a blood sample to measure the bile acids, then we feed the dog a meal, usually a high-fat meal, and then we take another blood sample, several hours later. And in you and me and a normal animal, the bile acids, they might go up a little bit after the meal, but not much, because most of it should never end up in the bloodstream. It should stay in this little loop here, right? If we measure your bile acids, it shouldn't end up in the regular bloodstream. But in patients with liver disease, it does. They eat this high-fat meal, they dump a whole bunch of bile into the intestines, it gets taken up, and then the liver just lets it pass right by. And it's real. So this is a very useful test for detecting liver disease. You can have animals with liver disease, and all the liver enzymes like ALT and ALP and GGT, they'll all look normal. Their cholesterol levels, albumin levels, they'll all be normal. They'll be normal, even though there could be some significant liver disease. The liver is kind of like the kidney, where a lot of it has to be gone or injured before we'll see certain changes in function, like glucose, albumin, bilirubin, cholesterol. So the bile acids test will detect a problem much sooner. Horses don't even have a gallbladder, but they make bile. So why do you think they lack a gallbladder? The main reason is because horses they're always eating, or they're very frequent eaters. You and I, we eat maybe 3 times a day, and so we eat these 3 big meals, and then we need bile then and there. The horse is always eating, so he's just always trickling bile into his small intestine. So it's kind of interesting. All right, our next stop is the large intestine. And the main thing here is that the large intestine is the main site of water absorption. This is part of why constipation can develop. If a patient cannot go to the bathroom, that more and more water gets absorbed, when I say they can't go to the bathroom, maybe they are being kenneled for too long or for whatever reason. Um, and more and more water gets absorbed, and then you get this kind of dry feces. This is also why when we have like an infection or inflammation of the large intestine, none of the water gets absorbed, and your patient has the squirts, right? They end up with colitis, this very watery diarrhea. Another thing that happens in the large intestine, especially in the herbivores, is what's called microbial fermentation. And it actually happens in you and me too, but it really is a huge deal in the herbivores, especially the horse and rabbit. And we'll talk more about that in a moment. I want to talk to you a little bit about, okay, so remember I told you that I had a life-changing experience at the state fair? Well, this was why. I was originally going to go to medical school, and then I volunteered at a hospital, and it was so depressing. Ugh, just all the fluorescent lights and the fake plants, and I just thought it was horrible. But I thought, well, if I'm not going to be a physician, well, what am I going to do? And my girlfriend and I went to the state fair, and I met some veterinarians there. I had no idea. I knew nothing about cows or anything. And I certainly didn't realize that cows needed veterinarians. And I started learning about cows, and they are just wild. They are crazy. And in particular, their digestive system is like something from science fiction. And horses too, but especially the ruminants. So let's talk about the ruminants. So, right, so like we said, when we started, how are these guys able to eat plants? How are all of the animals at the farm, they all eat things that you and I could not eat. Plants have this thing called cellulose in it, and that's part of the plant wall. And if you were to break up cellulose, right, over here I wrote, starch, glycogen, cellulose, those are all just chains of glucose. There is glucose locked up in all of that grass and weeds, but you and I cannot free that glucose. Or maybe it's fructose or galactose. I don't know. It's some sort of sugar. We don't have the enzyme that will allow us to break off the little pieces. Termites, we talk about how termites eat wood, but termites, they don't make the enzyme either. So how do herbivores and termites eat plants or wood if you're a termite? Well, I'll tell you, there are little bacteria. There are little bacteria living in the stomach of the termite. They make cellulase. They make the bacteria, they make the enzyme that can digest cellulase. But it gets, they can digest plants, but it gets even weirder than that. So we'll talk more about this in just a moment. The ruminants, they have, it's not really 4 stomachs. It's actually 4 chambers of one stomach. They actually have a stomach that's just like yours and mine, with stomach acid and, making hydrochloric acid and mucus and pepsin, and that would be the abomasum. Okay, but let's start at the beginning. So when food travels down the reticulum, it goes in. So when it travels down the esophagus, it's first going to spend some time in the reticulum and the rumen. We can kind of think of those 2 organs together. The rumen is this giant fermentative vat. It just, I don't know, it holds a lot of hay and liquid. It is not like a normal stomach. It's not acidic. It's kind of alkaline. It's got a lot of fresh food in there. The cow, the food gets moved and churned around in there and mixed, and then the cow regurgitates it, chews it some more on one side, and then another, and then swallows it. And it just keeps going through this process until it gets small enough, and until the bacteria are done with it, and then some of it can start to leave. But I'm getting ahead of myself. So we have the rumen and the reticulum kind of work together. Then food is going to travel into the omasum, and then the abomasum, and then on through the small intestines, duodenum, jejunum, ileum, things like that. Right. It just kind of just shows you the little path it takes. Here's what the rumen looks like. It's got this kind of neat, shaggy appearance to it. These just long, they're called papillae. Again, that increases the surface area. The reticulum has this honeycomb appearance. I think it's partly shaped like that to help kind of hold certain foods, to keep them from traveling into the abomasum. I don't know, but it just has this very, very unique pattern. In class, I normally bring some to school because one of my favorite dishes is menudo, and that's reticulum. So if you go to a market, look around, you may see, it'll be called, I think it'll be called tripe. I'm not sure what it'll be called. Maybe some of you know, but it's got, you'll see there's the reticulum right there. Yay, and it's very tender and flavorful and tastes great. Other animals are very similar to ruminants. The pseudo-ruminants like llamas and alpacas, they have a rumen. There it is. There's their big old rumen here. There's the rumen you're seeing on that side. Remember, the rumen's on the left side, and then the abomasum is on the right side. So here we are, we're on the right side of this llama. So that's the, we're looking over at the rumen. Here is the reticulum, and this is the abomasum. So they just lack that weird omasum, and we're really not going to say much about the omasum. We don't see very many problems with it. Okay, and so what's going on? The rumen in the ruminants and the pseudoruminants is like a jungle of life, and you'll see it's very similar in the cecum and the colon in horses and rabbits. There are so many millions of bacteria and protozoa in the rumen. There are people, they can get their PhD in the rumen, right? It's just a fascinating place. And we're traveling down a cow's esophagus, and we're going to enter first into the reticulum and the rumen. So you and I are a little piece of, hay, all right? And we're traveling down. There's some sort of a sphincter muscle, and whoa! Look at that, we're inside the rumen, and it's churning, and we're floating this way and that way, right? And we're just moving around. Eventually, we're going to see the reticulum. So yeah, now we're moving into the reticulum. We would normally stay, there, now we're seeing some bacteria. Looks like a spirochete. What is that? Anyway, these are all these life forms. And now we're moving, after several days, we start to move into the reticulum, right? There's the reticulum. There's more food coming in. That's kind of gross. No, that's great. It's very exciting. And now, does it take us into now we're leaving, we're traveling through this is the omasum. It's also called the Butcher's Bible. It has all these leaves. We don't see very many problems with the omasum. It's kind of cool if you ever get a chance to see it. And then after that, we're going to move into the true stomach, the abomasum, just named because it's next to the omasum, abomasum. So this is the true stomach of the cow. Now, with little Phoebe, the lamb, I've been thinking about this every day. So in a newborn ruminant, a calf, a lamb, right? We don't want milk going into the rumen. We just want it going into the abomasum. And there's this thing called the esophageal groove that I've never really seen. I have a kind of a hard time picturing it. But in young animals, when they're nursing, there's some little groove in their reticulum that when they suck, it'll direct everything towards the omasum and away from the rumen. So you can see this blue milk here. You see how it's not going into the rumen, it's just traveling into the abomasum. So that's called the esophageal groove. And that's just a way, because if it went into the rumen, it would just kind of sit there and get kind of stinky. So we don't want milk in the rumen. The rumen is developing. It takes weeks and months to develop. It's not ready on day one. And we're going to come back and talk a little more about, because I haven't even really told you what's truly bizarre about ruminants yet. If you thought that was bizarre, that's not bizarre. It gets more bizarre. Horses, it's a little different. You see the food here is going to travel right into the true stomach. It's called the stomach. The thing that's different about horses is they have this enormous large intestine. The large intestine is made up of the colon and the cecum in particular, and it is immense. The cecum, in you and me, you would call it the appendix, right? In you and me, it's just little tiny nothing. In the horse, the cecum is immense, this blind-ended sac. The colon is immense. And if you're ever at the farm, listen to Levi's colon. Just put your stethoscope here and here, and then go to the other side, and you'll hear this bloop, 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 bloop. And that's his I'm sorry, I said cecum. You would hear the cecum on the right side, but you'll be hearing his colon on both sides. And this is the same video we saw earlier. We're looking here. This is part of the colon. The colon in the horse, it's like two horseshoes that, it goes back, this U shape, and then it does this little bend and comes back again. So food is traveling towards the caudal part of the horse, and then it turns around and heads back cranially. And this is one reason why horses tend to get impactions, is you see these little tight bends here. That's a great place for food to get dry and to get an impaction here. So every one of these, they're called flexures. Those are spots where horses can form an impaction. They can really form an impaction anywhere, not just there. And I don't know why, but they can also have things like this, where this is what you saw earlier, where the colon is like it's torsion. You can call it twisting, but now everything is just filling up with gas. Well, it's filling up with I don't know what. But so horses are especially prone to impactions, torsions. There's all these things. We will learn a little more about that next year. Actually, a lot more about it. Okay, that's the end of part 2. Again, there should be a Kahoot on this. I will go and make sure there is, and I will see you in part 3.